What I'd like to do now, I know we have some time now, what I'd like to do now is to take an opportunity to answer any questions that you might have. And also I'd like to talk a little bit more, if you have interest in it, in the research that we're doing with the use of fasting at the True North Health Center.
Great. Thank you so much, Dr. Goldhamer. I really appreciate that. Great information. So as you just suggested, we're now going to begin our Q&A session. Just some information for the audience. I'll be asking some questions. I'll also be fielding some questions from the audience or presenting them to Dr. Goldhamer. And I just want to go over a few rules. We do not take questions directly from the chat. What we do is we take questions by people raising their hand. If you're not familiar with how to do that, you're going to click on the reactions button in the bottom of the Zoom window, second from the right, and you'll click on raise hand from there. I will pick on you and you'll say where you're from and you ask your question. And then we just ask that questions are brief and on topic. So with that said, I want to ask you a question about fasting. So I actually ran into you, I think it was 2020 at the Real Truth About Health conference, and I talked to you about doing a water fast, and you told me, don't bother, do the intermittent fasting. Can you speak a little bit more about that? Why intermittent fasting is a better route than doing a longer, multi-day water fast?
Well, actually, they're completely different situations. So the first thing you want to do is everybody, we believe, should intermittent fast, which is to limit their feeding window to 8 hours a day and get a 16-hour fast every single day. So that's something people can do without modifying their current regimes. They can do it safely. They can do it on their own. They don't need to come to True North Health Center to do a long-term water-only fast. Where long-term water-only fasting has its best application is one of two situations. Number one, you have healthy people that have decided for whatever reason they want to stay healthy. And so maybe once a year or so, they take time out and they fast for a week or so on water only after having led in properly on a good diet. And then they recommit to eating a whole plant food SOS-free diet in the time that's after that. We believe that, and we've got evidence now in research we've published recently, looking at cardiometabolic changes that occur in healthy people versus sick people. And as healthy as fasting is for sick people, the changes that occur in some of the cardiometabolic risk factors proportionally are even higher in healthy people than in sick people. It may be that people who get the very best benefit of all from fasting are actually healthy people using it to stay that way. Now, we've published a lot of literature on the effect of fasting on sick people, and long-term water-only fasting in sick people is profoundly impacting. We took, for example, 174 consecutive patients with high blood pressure, and 174 people were able to lower pressure enough to eliminate medication. We have the largest effects that have ever shown in treating hypertension in humans, with an average effect size of 60 points in stage 3 hypertension. If you have essential hypertension and you fast long enough, it's overwhelmingly likely that you will normalize your blood pressure and eliminate the need for medication. It's a condition you can learn to live without. Now, it's true. You still have to adopt a healthy diet and lifestyle in order to maintain the results, much like it is in obesity. But it is something that can be resolved. And that's another example where people have visceral fat that's causing problems. And the most effective way of mobilizing visceral fat, based on a study we've completed recently at True North Health Center, is fasting. Water fasting preferentially mobilizes visceral fat. So that, for example, a person that might lose 20% of their whole body fat during a 15-day fast lost 55% of their total visceral fat, disproportionate to the amount of adipose tissue loss. It's like the body can go in and take this visceral fat that's not supposed to be there, mobilize it first, because in some level it understands that's counterproductive tissue, just like it does with breast tumors. For example, you might lose 10% of your body weight, but you don't lose 10% of your breast tumor. You may lose 50 or all of your breast tumor. How does the body break down the breast tumor preferentially to your normal tissues? Because there's an inherent wisdom about how it does that, and that's one of the great things about fasting. It was necessary for all humans to be able to fast, because every human that couldn't fast died. Because during our early evolutionary history, spring would come late. And humans with our big bulbous neuronal net brains, if we didn't have the ability to last, until, food became available again, we would starve to death. It became so obvious that that's a biological adaptation, because every human being on the planet has this ability to change brain fuels from burning sugar to burning fat. So clearly it's a biological adaptation. Clearly it was so critical in our survival that we all adopted it. Now, today, we've applied that ancient practice to a modern situation, which is very rare. And that's where people have consistent dietary excess. And that's what the problem is today. Consistent dietary excess leads to visceral fat, that leads to inflammation, that leads to these diseases of excess. It's so ubiquitous now, we don't even recognize it. It's so obvious that we can't even see it. And fasting turns out to be the most effective way of reversing that very insidious problem.
You mentioned breast tumors going down during fasting. Is there research on that?
No, there's research that we published on lymphoma cancer. Those tumors go down. In fact, what's interesting is we just finished a couple of weeks ago a 9-year follow-up to the patient we originally published in the British Medical Journal, a stage 3 follicular lymphoma patient who started at 42 that had 2 years of progression. We fasted her for 21 days, resolved her tumors, got a 3-year, 6-year, and now a 9-year follow-up. She is cancer-free, continues cancer-free on a whole plant food SOS-free diet. Now, since then, we've got about a dozen patients, including one I have in my facility right this minute, who originally started off with stage 4 lymphoma with mets into the bones. And we have a 2-year follow-up CT scan and significant ongoing progression improvement. We've got a number of others that we'll be publishing as a cohort later this year. And eventually what we'd like to do is a clinical trial showing the effectiveness of fasting compared to the conventional cure and the treatment for lymphoma cancer.
Thank you. And regarding intermittent fasting, is there an ideal time window? There's talk of chronobiology. Michael Greger talks about it with regard to eating, shifting the window to the morning versus the afternoon. What does your research show?
Well, it's not crystal clear, and we don't do research on intermittent fasting. We do research on long-term fasting. But when you look at Walter Longo and others that have done a tremendous amount of work, the general consensus is that it's somewhere between 12 and 16 hours a day of fasting for intermittent fasting. There's good evidence supporting 12 hours. There's some evidence supporting 16 hours of fasting as being ideal. And there's a better support for the idea of eating the last meal earlier in the day so that you have at least a 3 to 4 hour block before going to sleep as the initiating of the fasting. So there's, I think, some general consensus for that, but it's not absolutely clear.
Thank you. So for people who do the 16-hour intermittent fasting, but can't get to True North Health for fasting, for the longer fasting, what other fasting do you recommend we do from our home, and how long should we fast, and how often, and how should we do it?
So we recommend that everybody fast 16 hours every day. That you can do without any additional support. If you're going to do longer term fasting, whether it's 2 to 40 days, we recommend a couple things get done first. Number one, find a physician that's not an idiot. Have a basic exam and screening, some basic labs, so that we make sure you're a good candidate. That's number one. Number two, if you're going to fast, you have to rest. You're not working and driving and doing all that kind of stuff. And three, make provisions for appropriate support and supervision. The mistake that people make at fasting on their own is they're too active, so they get dehydrated and have problems with electrolytes or kidney function, or they break fast inappropriately where they can get refeeding syndrome and can be very serious or even potentially fatal on a very long fast. So long-term fasting should be done with support and supervision. It can be done remotely in conjunction with your local doctor. It can be done at a place like the True North Health Center, where that's all we do is have people come in and do medically supervised fasting. But we see too many people making a mess of it to recommend that people do long-term fasting without getting appropriate baseline, appropriate rest, and proper supervision. And that's particularly true for people that have health problems or are on medications. Many drugs will be potentiated during fasting. You don't take medications when you're fasting. And so if people take medications while they're fasting, that can spell disaster. On the other hand, some medications can't be arbitrarily discontinued. So if you just discontinue those medications, you can actually get into serious problems, including with steroids and anticoagulants and other types of medications. So appropriate medical screening and monitoring is absolutely critical. For people that want help with this, we offer a free service. They can fill out the registration forms on our website, which gets me their medical history, and I'll offer them a free phone conversation to help them understand, are they a good candidate? Help them find a doctor that might be able to help support them. We have an extensive telemedicine practice of physicians that will do remote support for people, as well as facilities like the True North Health Center that are designed to supply safe and effective medical supervision for fasting.
Great. And I believe you already said it, but can you tell what the website is again so people can take note of that?
Yeah, if they go to truenorthhealth.com, they'll get to our website. The other website is the research site, which is fasting.org, which has all of the articles and studies available. As far as our free phone conversation, that you go to truenorthhealth.com, just complete the registration forms.
Great, thank you. And you mentioned the importance of refeeding after a fast.
Yes.
What should people be refeeding with, and what should they absolutely 100% avoid?
Right, so it's very important that refeeding be done properly. It's probably the most important part of fasting and the part that's most often messed up. It takes 1/2 the length of a fast on average to recover from fasting. So that means if you have let's say you do a 20-day water fast, it'll take about 10 days to get back to proper and normal full feeding. We use a day of juice for every week of fasting. That would be either fruit or vegetable juice, depending on the person and what their sensibilities are. We do a day of raw fruit and vegetables for every week of fasting, and then a day of raw and cooked vegetables for every week of fasting. So, for example, you may have a day or two of juice, a day or two of raw fruit and vegetables, a day or two of steamed vegetables, and then we would slowly introduce the more concentrated foods like steamed starchy vegetables and ultimately beans and nuts. So that by the time you've had half the length of the fast refeeding, you're back eating a whole plant food SOS-free diet. Too rapid a recovery to foods, or eating the wrong foods, like animal-based products or too much salt, can lead to post-fasting edema or even refeeding syndrome, where there's serious electrolyte disturbance, and in some cases has been fatal. And that's particularly true in people that are doing what I consider some foolish fasting, which is dry fasting, where they use no fluid. There's no solute to get rid of the toxins. It puts a lot of load on the kidneys. And as you may read on the internet, some rather famous people that have been advocating passed away recently doing that. So I would extreme caution about, if you're going to do fasting, do it right. If you're not going to do it right, don't do it, because it makes a bad name for fasting. We don't want that.